visual field. You can see the GCC and the RNFR on this side. And you can see the response with the OCT angiography. And it's just to show you with this case how we can interpret the reduction. You can see that on this both images and face image in OCT angiography, you can observe the reduction. But at the beginning of the study, we have now to quantify these defaults. So we have the first software to detect the non-perfusion areas, and we can see that we can detect few of these non-perfusion areas, but this part and this part was not detected with the system. So we move to the next proposition of OptoView and move to this analysis, and you can observe that in this quadrant we have reduction of this flow density. But again, you can observe that we have all those zones with no follow-up of this patient. So we are convinced that we have to observe a large zone, and you can observe that with this kind of approach, we can have all the detection of the problems. And so probably that in the next future we have to enlarge the analysis with a specific approach. Just for this case, it was to show you how we can analyze and how we can push other companies to measure and to develop the analysis of glaucoma in this case. The last case is this one. It's just a mix of the ultrasound and the OCT and the follow-up of the patients. We have this woman with an advanced glaucoma in the right eye, with 2 failed surgery. She had a tension at 18 with no medical treatment due to the surgery. Pachymetry is high. In gonioscopy, many peripheral anterior synechiae, many meridians, and on the fundus, no macular abnormality. On the other eye, the pressure is maintained by drops, and we can see with the gonioscopy that we have in the temporal part we can see the angle with pigmented lesion, but on all the other parts the angle was closed. So the doctor refers the patient with this kind of visual field. Is only on the right eye very dense, very violent reduction of the visual field, and on the other eye, on the left side, quite normal. You can see the RNFL and GCC, you can see all the difference. So the problem was, what happened with this patient? So the doctors have asked for an MRI, and no problem with the nerves and the brain. And so we have tried to raise this. You can observe the difference on the vascularization around it. So all things are correct. We have one eye with very dense glaucoma, very advanced glaucoma, and with the other eye, quite no problem. So due to the angle closure aspect of the gonioscopy, we've practiced UBM exploration. And you can see on the right eye how the angle is closed. It was a eye treated by filtering surgery. You can see the filtering surgery there with the blame, and you understand that the pressure is maintained in a normal way, but the angle remained closed with plateau iris mechanism. So we go to the other eye, and to the other eye we observe this plateau iris mechanism. You can see the angle is closed quite in each quadrant, but except in the temporal part. We have focused the UBM on this part, and we have practiced the test of light and dark to observe if we have a closure of the angle on this meridian in temporal. And you can see, focus on the 3 o'clock meridian in temporal, the reaction of the angle with light in the room and with dark in the room. So we can see that even in dark, this part of the angle is never closed. So it was very surprising because all the meridians of both eyes are closed in the dark. So we are looking to this patient, and to this patient, one thing that is not completely normal was the black reaction of the cerebral processes. As you can see on the other quadrants, look, this is a mid-reflective ultrasound response, and there you have an absorption of the tissue, and you have a quite black or dark response of the cerebral processes. So making a perpendicular cross of this part of the cerebral processes, we have discovered a nevus in the cerebral processes. This kind of patient show you that even if you have just the quadrant which is open, in this case, due to the nevus, you can maintain pressure, maintain the. And so this is a very, very interesting case, correlating optic nerve and glaucoma disease and anterior part and angle disease. Thank you very much.
Are there any questions? Can I ask a question about your second case? So there was a nerve fibrillary defect temporally. You mentioned that basically the flow density in one sector is small. Do you think that these either the grid pattern or the circular pattern might still be a bit crude at this point? Because what if the lesion were split between two sectors? Would the partially normal areas compensate for it, such that you would get enough of an increase?
Yeah, probably. When you have a sector reduction, you can have a correlation with the GCC and the visual field. When you have just little areas with reduction, probably it's not sufficient to go to the default of the visual field. But you have yet a few alterations with the prescription. So probably with the follow-up of these patients, that will show us if we are very efficient with the treatment and stop this area. If this area will enlarge.
Okay, if there are no more questions and comments, we're going to just have some hands-on. You know that there are at least three modules, three machines here. Please wander around.